Good morning, Katarina.
Hi, good morning, everyone. How are you?
We are doing fine, thank you. Are you having difficulties to join the link Zoom?
I did not have any. I was able to just follow the link that you sent in the email. I hope
All
that
right.
Kelsey will also
Yeah,
be
that's
able
why.
to.
We are
Yeah.
worried because last time she's having difficulties.
Okay. Yeah, maybe we can give her 1 or 2 minutes, but then I
Right.
can message
Hi,
her.
she's
She
coming.
is.
Hi,
Yeah.
Kelsey. Good morning.
Hello, sorry, I was using the wrong link, which was probably
Okay.
expected.
All right, we are on time.
Great.
Also join with us the director of health policy for system
Hi, good
health
morning,
system.
Kelsey and Catherine.
Yeah, Mr.
Good
Lupi.
Hi,
Good morning.
good
Mr.
morning.
Director Lupi, you may have the floor for the opening remarks.
Shall we start the meeting today? Okay, Basri?
Yes, but you have the floor to deliver the opening remarks, Director
Okay,
Lupi.
okay, thank you. Um, a very good morning, everyone. Distinguished Director of IHME's Organizational Development and Training Teams, Ms. Kelsey Bannon, and then College of the Ministry of Health, ladies and gentlemen. It is a great pleasure to welcome you all to this important meeting as we discuss the IHME GBD Fellowship, a program that holds a great potential for strengthening our health research and policymaking capabilities in Indonesia. The Ministry of Health highly values our collaboration with the Institute for Health Metric and Evaluation, which has been instrumental in advancing evidence-based decision-making through the Global Burden of Diseases framework. As we navigate complex health challenges, access to high-quality data and analytical skill is crucial to designing effective policy and intervention. The IHME GBD Fellowship presents an opportunity for our government employees to enhance their expertise in health metrics and policy analysis. By equipping our professionals with advanced analytical skill, we aim to build a cadre of experts who can contribute to data-driven health planning and ensure that our policy are aligned with the best available evidence. We are confident that this fellowship will not only benefit the selected participants, but will also create a multiplier effect, strengthening the ministry's overall capacity in health data analysis and policy formulation. This initiative aligns well with our national health priorities, including addressing non-communicable diseases, improving maternal and child health, and enhancing our health workforce planning. We sincerely appreciate IHME's commitment to capacity building and knowledge sharing. I look forward for a fruitful discussion today and invite Ms. Kelsey Bannon to share her overview for the fellowship, as well as to strengthen our partnership in the year ahead. Thank you very much for attending this meeting today. Thank you. Back to you, Ms. Rick.
Thank you, Director Lupi. So now I would like to kindly invite Ms. Kelsey Bannon to deliver your introduction and presentation. Thank you.
Thank you. Thank you so much, Director Lupi. That was such a fantastic introduction. I don't actually think my presentation is needed. I very much appreciate such a gracious and kind remark. So thank you so much. I will, thank you. I will go ahead into a few additional details of the fellowship that have not yet been covered. Please do interrupt me at any time if you have any questions. I'm more than happy to answer them as I go. And I'm hoping this will take 15 minutes or so, not incredibly long. So time for questions and discussion at the end. And of course, as I mentioned, please feel free to interrupt me. Can everyone see my slides?
Yes, it's
Thank you. And you can hear me all right?
yes, loud and clear.
Great. All right, so just a little bit more about IHME for those of you maybe that are slightly newer to our organization. The Institute for Health Metrics and Evaluation was established in Seattle, Washington, within the University of Washington 17 years ago. While we are based in Seattle, many of our staff are located across the country and around the world. We have our home offices, but also travel quite extensively, and that very much builds into our nature of collaboration and communication. When IHME first began, we were very much a research and analysis hub that still continues to this day, but with the advances in software engineering and large language models, we have a large staff of software engineers and developers as well, who work in partnership with our researchers to help produce the Global Burden of Disease study, which many of you are likely familiar with through your own work, and through our strong collaboration with PASS, Indonesia Burden of Disease Analysis. So IHME's most well-known research project is our Global Burden of Disease study. It very much aligns with our mission that everyone deserves to live a long life in full health. And what the Global Burden of Disease study does since its inception, even before IHME was created 17 years ago, is provides a comprehensive picture of what disables and what kills people across countries, time, ages, and sex. Of course, all of you on the call are very familiar with this as well, but this is part of the framing around why we believe this type of fellowship is so well positioned now, partially because there's ever increasing amounts of data, but also because as resources become more scarce in the changing global landscape, GBD is very helpful in helping us quantify what is preventing us from achieving our goal of everyone living long lives in full health. The GBD Burden of Disease Fellowship, in this regard then, is intended to create a cohort of fellows on an annual basis that can help use health metric science to shape health priorities. This is a very intensive fellowship opportunity that not only intends to equip our fellows with practical analytic and quantitative skills, but also their practical application into policy as well. Many of you are likely familiar with the various workshops, and I've probably seen you in Indonesia at some point with our either methods or results workshops. This fellowship is intended to provide a deeper dive for individuals who not only want to understand and apply global burden of disease methodologies, but also contribute to them themselves. We've had a lot of different pilot projects in different countries and settings around the world attempting to pass this knowledge on via several different means, whether it's a 2-week workshop or the embedding of an IHME faculty member in a team. And what we've really come to learn is the fellowship model of having a cohort together for an intensive and lengthy training actually provides the most sustained and integrated model of learning, and then allowing people to return to the settings that they've come from to help kind of create that ripple effect and building capacity. I think, as Director Lupi said very well, it's creating that ripple effect through the community that allows the burden of disease methodology to be applied. Now, this, as you all are likely aware, this is part of our larger collaborator network as well. And I know several of you are involved collaborators, but the GBD network itself is built upon the strength of this collaboration. We have over 12,000 collaborators in almost all countries and territories around the world. And these are individuals who have signed on to the Global Burden of Disease Protocol. And this allows them to not only contribute data to the Global Burden of Disease study, but also be privy to early reviews of results and analysis prior to the peer review publication submission process. Becoming a fellow is a great way to gain entry into the collaborator network, but it also allows you to gain access into additional tools, trainings, resources within the network, and then building those counterparts and camaraderie through there. So another reason for the rationale for this fellowship, besides what I've stated earlier, is it's an explicit need for additional researchers in the field of health metrics. I recently attended the PMAC conference, where I know there were several individuals from Indonesia and the Ministry of Health, the insurance industry as well, having the opportunity to dialogue with them. Having a shared community of practice around health metrics is particularly valuable now. We are trying very hard to recruit a cohort with some emphasis on the ASEAN region, but also trying to build cohorts in other regions as well to build a better network of health experts around the world. And besides just global burden of disease, the knowledge that will be used beyond just subnational and national burden estimates can also translate into forecasting estimates, health financing. There will be opportunities for the fellows to study different data systems and data implementation opportunities. So this type of practical hands-on experience combined with a methodological background will be hopefully quite helpful. So this is IHME and our burden of disease pyramid of learning, and one of the ways that we think about how we provide training and education to interested cohorts. At the very top of the pyramid, you'll find the expert level of burden of disease and health metrics knowledge, and that's really where we find the fellowship program located, as well as IHME's PhD program. The individuals that ascend to the pyramid, highest level of the pyramid, will become fluent in methods development and production. This does not necessarily mean they will be able to complete an entire run of the global burden of disease themselves, but this will allow for a greater deal of fluency in the project and also incorporation of various methods in their own homework. The next level of the pyramid is our advanced intermediate level of learning around health metrics and the global burden of disease study. This allows learners to interpret results from our studies, conduct some analysis of the data outputs and results, and then also apply the impact of those results in their own home areas. For those learners, we have our master's program also within our health metric sciences department. We have certificate programs as well, which are slightly longer in duration, but targeted online learning. And then we also have workshops, which are both in-person and virtual, that allow for a lower level of methods understanding, but allow for the learners to have some application experience as well. And then last, the bottom level of our IHME GBD learning pyramid is our introductory level. And that is for individuals who are interested in learning how to use IHME's online tools and visualizations, interested in learning more about data extraction methodologies, as well as how to manipulate and create data inputs, advice on primary data collection systems, interpretation of vital registration, census, things like that. And then really the core basic skills of health metrics and population health. So for those learners, we offer online trainings, regular webinars, and then recorded media as well, like introductory videos and things like that. So obviously, for the purposes of this presentation, I'm talking about that highest tier. It's the largest investment, obviously, the most time and mental energy required, most rigorous. But there are also options below that are available to different cohorts and are in various stages of being rolled out. So on the logistics of the program, the fellowship is intended to be 2 to 3 years at IHME in Seattle. The first year is intended to be in Seattle, and then years 2 to 3, there is an option to remain in Seattle or to return to the home organization or country to continue the fellowship remotely. The third year in particular is an emphasis on application of results, and I'll talk about that more in a moment. The fellowship is specifically targeted to individuals with a doctorate and higher level degree, PhD, MD, DPhil, MBBS. There are opportunities to wiggle that around depending on the amount and type of professional experience prior to that, and I can help explain that on a case-by-case basis. The beauty of having a fellowship that's based in Seattle is the opportunity for fellows to be embedded within research teams and trained directly with our GBD experts in this field. A lot of the learning comes from the in-person interactions through research team meetings and other elements like that. The components of the program, they begin with a 6-week orientation, again in Seattle, and something that we call boot camp. It's not as physically grueling as a traditional boot camp, but mentally it is quite challenging. Very long days, including the weekend. It's overviews of IHME's main research projects, our statistical packages, so really boot camp training in the coding languages that we use, including R, Python, and a few others. An orientation to IHME's key methods that are developed, and then a landscape analysis of the current health metrics challenges that are facing the world now. So it would likely include things like climate change, migration, conflict, the rising age of the population. Throughout the course of the remainder of their fellowship, there's regular trainings, both in week-long series and then also interspersed on things like the GBD framework, quantitative methods, more in-depth exploration, more coding, programming, and development, theory of health metrics, and then, as I mentioned, in addition to an in-depth analysis of the global burden of disease, this will also allow fellows to become engaged with our other IHME methodologies, in particular, our forecasting team package of research and our health financing teams as well. There's a heavy mentorship component to the fellowship as well from IHME's key faculty. There's a focus on not only the professional, personal, and career development of our fellows, in particular, their intended application of this body of work once they return to their home organization. And then there's a significant cohort building as well, which is, as I mentioned before, one of the reasons why we like to have these individuals based in Seattle for the first year at a minimum, so that they're able to form a very solid network. And then beyond all of this, our fellows emerge from this program with a much more improved ability to perform, learn, and achieve within a very rigorous multidisciplinary environment like IHME. There's shadowing opportunities, conference attending opportunities, and then other elements where the fellows are able to kind of hone those skills and then also watch as experts in these various fields interact and help to influence policy in their different arenas. So that is the slides I have now. Myself and Dr. Emanuela Gakidu, who unfortunately has not joined us today, but she's another representative of the program, are available to answer questions now, of course, but also via email. You've noticed the QR code that's in the presentation. You can sign up there and we will send you links to timelines for when the fellowship will be opening. The intended start date of our next round of fellows is in January of 2026, with applications being accepted in the spring of this year. I don't want to speak too soon. IHME will provide support on visa procurement because that's obviously going to impact timelines quite a bit, which is one of the reasons why we are trying to get the application process and interview process off quite quickly. That is what I have in terms of my presentations. Are there questions that I might be able to answer or anything that would be helpful to revisit?
Okay, thank you, Ms. Kelsey Bannon, for the presentation. Before we go to the question and answer, we have 145 participants in this Zoom call, but I would like to announce Director of the Development Competence of Government Employee, Ms. Dwi Melanie, as the Director of the Center of the Capacity Building of the Government Employee, to give the introduction for this great facilitation of this Zoom call this morning. Ms. Dwi Melanie, please kindly have the floor.
Yeah, thank you, Dr. Sri, and also the IHME, Ms. Kelsey Bannon, and Emanuela. Thank you for the great presentation and the introduction. This is really a great program, And we do hope that many opportunities can be utilized by the Ministry of Health employees for this fellowship program. And also, if possible, for the IHME also, maybe we can collaborate for us, other than the this fellowship program, maybe if we can have like the online training for this data analysis and etc. So we hope that many potential collaboration ahead. Thank you.
Thank you
so
very much. Yes, Ms. Kelsey, you may want to respond on the Director Dwi Melanie.
Thank you so much, Director. We would be happy to collaborate, of course. We have additional resources we would be delighted to share, and perhaps we could follow up after this so we could be sure that we provide something that suits your needs. And it sounds as though your office in particular is quite aligned with our goals as well. So we'd be very happy to collaborate together. Thank you.
Thank you.
Thank you very much. Thank you, Ms. Kesley. Thank you, Director Dwi Melanie. So I would like to invite participants to have your question by raising your hands, because in the Zoom we have so many participants. We have one raised hand from Mr. Arya Kusuma. Mr. Arya, you have the floor.
Thank you, Dr. Sri. I just want to ask one question only about the requirement of this program, because I'm too old, I'm not young enough. How about the limited of age of the requirement? Is there any limit of age?
No, we would appreciate a greater diversity in age and wisdom. So there is absolutely no age requirement.
Okay, thank you.
Okay, thank you.
Thank you,
Arya,
Dr.
Mr. Arya, you are coming from the hospital?
Yeah, right now I work at a National Mental Health Center at
Okay.
Marzuki Mahdi Hospital, a mental health hospital.
All right, thank you. Thank you for the question. So I would like also to invite other participants if anyone would like to share the question. I don't see none, so maybe I can ask first, Ms. Kelsey. We have one, Miss Visia. Oh yeah, Miss Visia from our Health Polytechnic School. Miss Visia, you have the floor.
Yeah, thank you. Thank you, Kelsey, for the presentation. So I think this is an interesting opportunity. So actually, I graduated from King's College London 2 years ago, and I've been seeking for the opportunity, the fellowships, and this is, I think, great opportunity for me to apply such programs. Okay, so I'm just wondering whether there are specific projects for me, maybe that projects would be suitable for my expertise. So my expertise is in air pollution. So I think that's kind of air pollution projects might be suitable.
Yes, thank you so much. It's very nice to meet you. And I've put my email address there in the chat. So please do feel free to follow up with me offline. We have an environmental and occupational risk factors research team that focuses both on indoor and outdoor air pollution in terms of risk quantification and subnational analysis all the way down to a very small area in order to help not only provide estimates of years of life loss, but also to help with risk forecasting as well. So that would be very well aligned with your research area, I think.
Oh, that's good. And what about the data? Do we need to use the global data or specific to Indonesian data?
Our risk factors team uses data from every country in the world, including Indonesia, at as small of a level as we're able to collect it. If you go to our GHDX, that is our Global Health Data Exchange, you can actually search through our Indonesian data sets to see what air quality data is there. You can also go online to GBD Compare and look at our air quality information data there, and it will give you a link where you can directly export all of the data that we have available.
Okay,
Yes,
One
and
more
if you have any
question.
trouble,
Yeah.
please email our help desk. It's actually run by real people, and they're very happy to help you navigate the tool and the data set downloads. Often what we find from our collaborators, such as yourself, is once you're able to look at the Indonesian data, you're often able to point out what is missing, and then we can work together to help supplement it. So that is a real strength of our collaborator network, as well as partnerships like this.
Okay, thank
Okay.
you, Ms. Kelsey. Ibu
Yes,
Sri,
and
ada lagi?
Katrina is very helpfully
Can I
putting
ask
these in the
one
chat.
more question?
Of course, yes, please.
Should we contact a potential supervisor to apply this program, or we just apply the program and then see who is the person who will be our potential supervisor?
Oh, I'm sorry.
mean,
Is that a question for me?
yeah.
I thought you
Is
were
that-
referring
should-
to your current supervisor. No, you
Yeah.
can apply via the open application, which will be opening within a few weeks. If you sign up for the email updates, this QR code here will take you right to that page. Katarina could probably put a link to that in the chat as well, if she's able. And then we will run you through the application process. There will be interviews and tests, and then we will actually assign you to your research team.
Okay, thank you.
Thank you. So we go to the next question, Ms. Kelsey. We have Ms. Telly, one of the lecturer as well from our Health Polytechnic School.
Thank you.
Ibu Telly, you have the floor.
Thank you so much, Ibu Sri, and thank you so much, Kelsey, for your nice presentation. I'm so sorry I cannot open my camera because of the internet connection issue here in my place. So and also my apologies because I was late, so I couldn't catch up the whole information from you, Kelsey. So my first question is there any for the first year? Do we need to stay for the whole year in Seattle because I see on your presentation that the first years will be in Seattle. So do we need to stay for the whole year, or we just have need to attend the 6 weeks orientation? Yeah, I see on your presentation. And the second question is this: do we need to develop our proposal first in order to apply this project? Because right now I have like a project regarding the develop model for the tuberculosis among children under 15 years old. I have the proposal. So do we need to develop proposal in order to apply for this project? Thank you. Thank you, Ibu Sri. Thank you, Kelsey.
Thank you. The requirement is to be in Seattle for the full year, 12 months. The first 6 weeks is a very intensive boot camp. Following that, there will be regular on-site trainings as well as meetings with the research team and general practicum-based experience. In our past, we've run a lot of different types of fellowships, and the key really to their success has been having an in-person cohort for at least part of the fellowship. If fellows are able to stay past year 1 into year 2, that's also something that we would be very supportive of, but we understand a year is a very long time, especially to be away from all the different obligations people have. But the 12 months is the minimum, very strongly encouraged. The second part, having a proposal developed, that is not necessary. We will ask for your CV, of course, and of your research interests and areas. But when you're at IHME, your work will be taking part in a research team. That very applied setting is very critical to gaining some of the skills necessary to understand how the GBD works. So while you might have a subject area you're particularly interested in, a region that's your specialty, we will put you likely in that group. What we're most focused on is creating a well-rounded GBD expert. And so for that will be integration into one or a variety of research teams via a rotation. If you have more questions about that, please feel free to let me know as well.
Thank you, Kelsey.
Thank you, Kelsey.
Thank you, Ibu Telly. So we go to the next question, which is Miss Komang Ayu from one of the lecturers as well from our Health Polytechnic School. Ibu Ayu, please have the floor.
Good morning, everyone. Thank you, Ibu. I work at Sanglah Ngurah Hospital, but
Okay. My
also
apology,
a
my mistake.
lecturer. No, I'm
Okay.
also a lecturer at
Okay, that's
Korean
good.
University and some of the private like nursing school in Bali. So my question is, how will you doing your selection for us? Means that maybe some of us is graduated from Indonesian university, means not the PhD one, but doctoral degree. So what about that?
Mhm.
What is the requirement? Must be the PhD one? Thank you.
Thank you. There is no requirement for type of university to have graduated from, simply the type of degree. We have a fairly rigorous application process that will include an interview and then some specific assessments that will be conducted for the applicants. So a lot of the vetting will be done by IHME. So there's a CV requirement so that we can understand the background of the applicants. But then beyond that, most of the assessment will be done by IHME once certain criteria have been filled. Does that help
Okay.
answer the question?
Yes, thank you so much. Thank you, Ibu.
Thank you, Ibu Ayu. We still have one more question in the chat from Miss Henny. The question is there a specific desired outcome? Can non-communicable disease in Indonesia be implemented in new research? Thank you. Ms. Kelsey, you may want to respond on that.
Of course. Non-communicable diseases are included as part of the burden of disease portfolio in Indonesia. So those are actually part of the study now. If that is your area of expertise, we would certainly welcome you to apply as a fellow or to join the GBD Collaborator Network as well. For those of you that are just learning about the fellowship program, but that's not your area of interest or something you're not interested in pursuing, please do consider joining the GBD Collaborator Network, which you can learn more about on IHME's website. The bar to entry is quite a bit lower. You just sign on to our protocol, but then you're able to review early versions of the data that's used for analysis, and also have the potential to become a co-author on our subject matter papers, not only our capstones, but our specific papers like those on non-communicable diseases, as well as sign up to write a regional paper of your area of expertise as well. So please take a look at that if that's also something that you're interested in. And thank you, Katerina. She's also put a link to that in our chat. I should have put that on this slide, but that's just another option if you're interested in participating more.
Okay, thank you. So I have one question about the slides. Is it possible if you can share the slide in the chat? Some people, some participants joining very late, so
Yes,
they might miss the presentation. Thank you, Miss Kelsey.
I would be happy to do that. I don't know if I have a public link yet, but I will. I'm not sure if I'm able to share outside my network. Is it possible for us to email them to you?
Okay, that's
I
good.
will do that.
I'll share with them. Thank you so
Very
much.
good.
Oke, Bapak Ibu yang lain mungkin ada lagi yang ingin bertanya, persilakan. Is there anyone else from the Zoom call would like to
Ibu
ask
Sri,
question?
maybe I would like to add one more questions. Teli,
Yes,
Ibu,
please,
Teli.
Ibu Teli.
Yes, I just would like to know the due date for this application, the due date for the application. Thank you.
Yes, thank you for asking. Please sign up for updates from the fellowship webpage, and we will provide you those dates soon. We haven't opened applications yet, but that is forthcoming. So I suspect it will be sometime in the month of March. We'll open applications, and then maybe June is when they'll end, but please don't quote me on that. The committee is still finalizing their timelines right now.
Thank you.
Okay.
Thank you so much.
Thank you. If we go see the raise hand, we don't have raise hand, and also from the chat, we don't have any more question. So I would like
Maybe Dr. Sri, can I add one
Oh
more
yeah, sure.
thing? So how many
Miss
people
Ayu.
will be selected or choosing by this program?
The size
many
of the size of the cohort,
Yeah,
we are aiming for about a dozen every year, so 12 people.
12 people. So from Indonesia will be 12?
No, it's a global fellowship, so the intention
Okay.
is to select across the world. Yeah,
Thank you.
but it's an annual fellowship, so the intention is to continue to build upon it. And of course, if we get additional funding to support it, we would be able to expand that number a bit. But just based upon organizational capacity and trying to ensure a really fulfilling opportunity, we would probably cap it at about 15 to 20.
Thank you
Right.
very much. Thank you,
Thank
Dr.
you.
Sri.
Thank you, Ibu Ayu. Thank you, Kelsey. So do you have any more additional statement from Kelsey or Miss Katerina? Because we don't have any more question from the participant. There is one, sorry. One raised hand from Miss Luluk Widarti. Ibu Luluk, you have the floor.
Thank you, Dr. Sri. Itu Mr. Kelsey, ya. I would like a collaboration on this set about situation. Is that possible? Thank you.
I'm so sorry, I did not understand that question.
Yeah, can you repeat again, Ibu Luluk? Repeat, please.
Yeah.
The question.
I would you like to collaboration on research about stroke patient. Is that possible? Thank you.
Mau collaborate tentang pertanyaannya tentang apa, Ibu? Tadi putus-putus suaranya, Ibu.
Collaboration on research stroke patient. Is possible?
Apa, Bu?
Thank you.
Riset apa, Bu?
Riset pasien stroke.
Oh,
Dr. Sri.
okay. Research on stroke for patient on stroke. Is that
Yes.
a possibility, Miss Kelsey?
Yes.
Yes. Yeah, we have a cardiovascular disease team as well as other incidents that arise from it. That is also part of the burden of disease portfolio. So yes, and as I mentioned earlier, if a fellowship is not in your interest or career trajectory, you're welcome to join our collaborator network as well for a slightly lower level of involvement, but also with great participation opportunities. So please consider that.
Thank you for
Thank
the
you
answer.
very much. Thank you, Dr. Sri.
Thank you, Ibu. One more question on the chat. No, she just saying thank you for the great presentation about this fellowship. I'm very interested for this opportunity. Thank you, Miss Kelsey. You have any final statement before we are closing with Director Lupi? Please, Miss Kelsey.
Thank you all so much for your attention and enthusiasm for this program, and also broadly with the collaboration with IHME. We've always felt extremely welcome and included in a collaboration. So we thank you so much for that. We very much look forward to welcoming applicants to the fellowship program once the application opens. But I'm also quite hopeful, and on behalf of Dr. Steve and Dr. Chris Murray, that we will also be able to continue this collaboration in many other ways as well.
Thank you very much, Ms. Kelsey. Now I would like to invite Director Lupi. We have one more, if you don't mind. One more final question from Mr. Jalin Sitompul. Ya, Pak Jalin, silakan.
Okay, thank you. I want to ask about, I'm sorry I'm late to join. About the age, there is no limit age for this fellowship.
There is no age limit. That is correct.
The question is, age limit. Okay. The question is about the age, Mr. Jalin. So,
Yes, that's right.
okay, so we already answered the question. If we don't have any more question, then we would like to close this session. I would like to invite Director Lupi for closing remarks.
Thank you, Dr. Sri. Thank you very much, Ms. Kelsey O'Bannon, and also the team. Catherine also here. We already finished our webinar series today, and we saw that there are many questions that our colleagues interest to join the fellowship that already described by Ms. Kelsey. So we hope some of our colleagues from the Ministry of Health can apply or can meet the requirement that already states in the presentation. Thank you so much, Ms. Kelsey, and I hope this is not the last moment that you can present the presentations. Maybe for next webinar, you can also share with us any others important knowledge or the information. Thank you so much for the presentation.
Thank you.
Back to you,
Thank you,
Dr.
Director
Sri.
Lupi. Thank you, Ibu Karterina. Thank you, Miss Kelsey. Thank you, everyone. Have a nice day.
Thank you so much.
Thank you,
Bye-bye.
Have a nice
everyone.
day.
Miss Kelsey, Miss Catherine.
Thank you. Thank you, everyone.
Bye-bye.
Makasih Bapak Ibu.
Thank you. Sehat. Makasih Bu Sri.
Terima kasih, Bu Sri.
Iya, Ibu Teri. Sukses mudah-mudahan aplikasinya.
Iya, Ibu.